Hypoparathyroidism. Definition. Hypoparathyroidism is decreased function of the parathyroid glands with underproduction of parathyroid hormone. This can lead to low levels of calcium in the blood, often causing cramping and twitching of muscles or tetany, involuntary muscle contraction, and several other symptoms. Hypoparathyroidism is defined as underfunction of the parathyroid glands with deficient production of the hormone parathormone, which leads to low blood calcium, hypocalcaemia. They may be missing due to a birth defect, impaired by autoimmune disease, or surgically removed during thyroid surgery. Causes. Hypoparathyroidism occurs when parathyroid glands don't secrete enough parathyroid hormone. Factors that can cause hypoparathyroidism include neck surgery. This most common cause of hypoparathyroidism develops after accidental damage to or removal of the parathyroid glands during surgery. Neck surgery may be done to treat conditions of the thyroid gland, or to treat throat or neck cancer. Autoimmune disease. In some cases, immune system attacks parathyroid tissues as if they were foreign bodies. In the process, the parathyroid glands stop producing their hormone. Hereditary hypoparathyroidism. In this form, either people born without parathyroid glands or they don't work properly. Some types of hereditary hypoparathyroidism are associated with deficiencies of other hormone-producing glands. Low levels of magnesium in blood. Low magnesium levels can affect the function of parathyroid glands. Normal magnesium levels are required for normal production of parathyroid hormone. Extensive cancer radiation treatment of face or neck. Radiation can result in destruction of parathyroid glands. In rare cases, radioactive iodine treatment for hyperthyroidism may lead to hypoparathyroidism. Risk factors. Factors that can increase risk of developing hypoparathyroidism include recent neck surgery, particularly if the thyroid was involved. A family history of hypoparathyroidism. Having certain autoimmune or endocrine conditions, such as Addison's disease, which causes a decrease in the hormones adrenal glands produce. Symptoms. Signs and symptoms of hypoparathyroidism can include tingling or burning in fingertips, toes and lips, muscle aches or cramps in legs, feet, stomach or face, twitching or spasms of muscles, particularly around mouth, but also in hands, arms and throat, fatigue or weakness, painful menstrual periods, patchy hair loss, dry, coarse skin, brittle nails, depression or anxiety. Diagnostic evaluation. A doctor who suspects hypoparathyroidism will take a medical history and conduct a physical exam. Blood tests. These findings on blood tests might indicate hypoparathyroidism. A low blood calcium level, less than 8.5 mg/dl. A low parathyroid hormone level, less than 10 pg/ml. A high blood phosphorus level. A low blood magnesium level. The doctor might also order a urine test to determine whether body is excreting too much calcium. Management. The goal of treatment is to relieve symptoms and to normalize levels of calcium and phosphorus in body. A treatment regimen usually includes oral calcium carbonate tablets. Oral calcium supplements can increase calcium levels in blood. However, at high doses, calcium supplements can cause gastrointestinal side effects, such as constipation, in some people. Vitamin D. High doses of vitamin D, generally in the form of calcitriol, can help body absorb calcium and eliminate phosphorus. Magnesium. If magnesium level is low and client is experiencing symptoms of hypoparathyroidism, doctor may recommend that client takes a magnesium supplement. Thiazide diuretics. If calcium levels remain low even with treatment, thiazide diuretics can help decrease the amount of calcium lost through urine. However, some people with hypoparathyroidism, including people who inherited the condition, shouldn't take thiazide diuretics. Parathyroid hormone, Nathpara. The US Food and Drug Administration has approved this once daily injection for treatment of low blood calcium due to hypoparathyroidism. because of the potential risk of bone cancer, osteosarcoma, at least in animal studies. This drug is available only through a restricted program to people whose calcium levels can't be controlled with calcium and vitamin D supplements and who understand the risks. Intravenous infusion. If client needs immediate symptom relief, doctor might recommend hospitalization so that he can receive calcium by intravenous, infusion, as well as oral calcium tablets. After hospital discharge, client will continue to take calcium and vitamin D orally. Diet. The doctor might recommend that client consult a dietitian, who is likely to advise a diet that's rich in calcium. This includes dairy products, green leafy vegetables, broccoli and foods with added calcium, such as some orange juice and breakfast cereals. Low in phosphorus. This means avoiding carbonated soft drinks, which contain phosphorus in the form of phosphoric acid, and limiting meats, hard cheeses and whole grains. Monitoring. The doctor will regularly check blood to monitor levels of calcium and phosphorus. Initially, these tests will probably be weekly to monthly. Eventually, client will need blood tests just twice a year. Because hypoparathyroidism is usually a long-lasting disorder, treatment generally is lifelong, as are regular blood tests to determine whether calcium is at normal levels. The doctor will adjust dose of supplemental calcium if blood calcium levels rise or fall. Complications. Hypoparathyroidism can result in various complications. Reversible complications. The following are due to low calcium levels, most of which are likely to improve with treatment. Cramp-like spasms of hands and fingers that can be prolonged and painful, or muscle pain and twitches or spasms of the muscles of face, throat or arms. When these spasms occur in throat, they can interfere with breathing, creating a possible emergency. Tingling or burning sensations, or a pins and needles feeling, in lips, tongue, fingers and toes. Seizures. Problems with kidney function. Heart arrhythmias and fainting. Irreversible complications. Accurate diagnosis and treatment might prevent these complications associated with hypoparathyroidism. But once they occur, calcium and vitamin D won't improve them. Stunted growth. Malformed teeth. Slow mental development in children. Calcium deposits in the brain, which can cause balance problems and seizures. Clouded vision due to cataracts.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.